Greetings, AACP members. Today we bring to you a topic that's close to my heart on pharmacy student advocacy, opportunities, and recommendations. The contributors to this session are myself. My name is Meghana Aruru. I'm an assistant professor at the Roosevelt University College of Pharmacy. My co-presenters are Dr. Anandi Law, and she's a professor at the Western University of Health Sciences, and Dr. Vibhuti Arya, who's an assistant professor at St. John's University. Today, we're going to talk about the need for advocacy, advocacy opportunities while in pharmacy school, how to get students involved, and some examples along with a key message towards the end. Merriam-Webster actually defines advocacy as the act or process of advocating or supporting a cause or proposal. A lot of us may have been involved in advocacy while as students or even in our own professions. And to us, it's probably much more clear as to why we advocate. However, to our students, it may really not be as clear. And so, with the new healthcare reform, there are several key elements of healthcare that are yet to be addressed. Pharmacy students can be effective in identifying issues around access to medications, health disparities, to name a few, to advocate for their chosen profession. Better for patients. Pharmacy students can also be a key for advocacy towards building stronger systems, which may lead to better care for patients in terms of patient safety, medication use, etc. With the advent of medication therapy management and drug utilization reviews, pharmacists have really taken a central role in working with patients towards optimal medication therapies. And so, in this role, pharmacy students can serve as wonderful advocates for their own chosen profession by working alongside other healthcare providers, as well as educating other healthcare providers and other healthcare provider students in the role of the pharmacist, truly as the medication therapy expert. Pharmacy students may also advocate towards improving clinical impact. Some other issues for advocacy may include reimbursements for cognitive services, health information technology integration, and any more that come to your mind. Today, there are several pharmacy organizations that are involved in advocacy. As you can see, the American Pharmacists Association, the National Association of Chain Drugstores, the Accreditation Council for Pharmacy Education, the Academy of Managed Care Pharmacy, the American Society of Health System Pharmacists, to name a few, are involved in advocacy issues. They also provide several opportunities for students to be involved in their advocacy. Student advocacy truly represents the future of the profession. The students at this point in time are experiencing healthcare reform which will impact their future practice, and being aware of these issues while they're still in pharmacy school helps prepare them towards a more meaningful practice in the future. They will be able to understand the dynamic nature of healthcare and eventually, hopefully, impact change. A lot of advocacy hinges upon just being in the right place at the right time. Student pharmacists can gain valuable leadership and advocacy experience through professional organizations such as the ones mentioned before, either through their own didactic or experiential curriculum, if that's something that's being offered within your own universities, or by identification of causes and unfulfilled needs in a community. Advocacy can be defined into several different categories. We used an ounce of prevention fund as our source for the different kinds of advocacies presented here. First of all is case-based advocacy, where someone may work with a patient or a family case or a problem, so it's one problem at a time. So it only affects a particular patient or a family. It's a particular program or policy that they're talking about. It may involve meetings with local staff, filing appeals, a lot of documentation in the process to resolve this issue or resolve this case. The next level up would be administrative advocacy, which may involve creating new policies, revising guidelines, resolving problems, and so on and so forth. It does require developing ongoing relationships with agencies and other advocates. Students may end up participating in forums or group discussions as well as providing reliable information on the impact of such policy decisions within the community or agency that they're advocating for. The third level up would be legislative advocacy, which involves working with elected officials to educate them about policies or program impacts. This may involve communicating with legislators, preferably testifying before relevant committees, possibly working with legislators towards proposal adoption, may involve meeting with governmental staff and even inviting legislators to visit the program and see policy impact. I believe a lot of schools are involved with what is known as officially Legislative Day, and a legislative day would be an example of the legislative advocacy that I just talked about. Media advocacy would be the last leg of advocacy, where students may use media to create awareness and influence broader public debate. If any of you have used YouTube, you can look up Pharmacy Student Advocacy on YouTube and you'll find several videos where students have advocated for smoking cessation, for alcohol, drug abuse, all the other issues that plague today's healthcare system. Media advocacy also takes the form of writing letters to editors. They could contact local reporters, contact local radio or TV stations. Some of it may involve actually identifying the impact persons or families and then sharing pertinent media coverage with elected officials. Towards the end, some of our key messages that we're bringing to you with this presentation are that advocacy really needs to be emphasized and enhanced in the PharmD curriculum across the United States. Advocacy is key towards investing in the future of our profession, and faculty can serve as role models towards advocacy by talking about it, being engaged and involving their students in continual engagement. Advocacy can be done in class. It could be on an experiential rotation. It could also be done in professional association activity. There is really no limit as to the avenues which someone can take for advocacy. And in the end, we leave you with the last few words. A leader is one who knows the way, shows the way, and goes the way, by John Maxwell. Thank you for listening in.